Susie. My name's Sarah. I'm going to be your nurse today. Before we start, can I just get your name and your birthday?
Susie Johnston, May 4th, 1996.
Okay, perfect. So, Susie, what I'm here to do right now is just a quick straight cath. You haven't been voiding like we'd like you to be, so it looks like you have some urinary retention, which could cause a UTI and just some other issues. So we don't want that urine to just sit in your bladder. We just want to go ahead and get rid of that and void that out. But before I start, do you have any allergies to seafood, shellfish, or like iodine or latex, anything like that?
Nope, no allergies.
Okay, perfect. So I can go ahead and start then. Real quick, I'm just going to kind of raise your bed up to my height. Are you in any pain today?
Nope, I'm actually feeling pretty good.
Oh, good. Okay, well, I'm just going to do hand hygiene. Let's get my goggles on here. Gloves. So before I start with the actual procedure, I'm just going to do some pericare to wipe that area clean before we start.
Sounds good.
All right, I'm going to bring my table over here, raised, and so I'm just going to make sure that the area is private, everything. Okay, I'm going to go ahead and pull down your blankets. It's going to be a little bit cold here. Open your legs a bit. All right, so I have some washcloths here. Again, just going to kind of clean that eye. Down. Okay, and then the last step is I just have to roll you to your side because I'm just going to wipe from behind. Get all that cleaned up here. Okay. Now I'm going to go ahead and leave your legs kind of propped up like this because we're going to have to insert that catheter, and this is the best. So I'm just going to discard my gloves, do hand hygiene. All right, so this is a sterile procedure here, Susie, so I'm just going to kind of go ahead and use this area down here. If you'll try and hold still for me so nothing is contaminated.
No problem.
I have a 1-inch margin I can work with here. All right, so I have this open. Again, I've done hand hygiene. I'm going to put new gloves on again, and then I'm going to go ahead and insert one more kind of like Chuck's pad down. That kind of prevents any leakage from getting onto your sheets or anything. Just keep everything clean. Okay, so now I'm going to do hand hygiene again. Now, Susie, I'm going to open my sterile gloves. And if I can just go ahead and use your chest here to kind of open these up.
That's perfectly fine.
Thank you. All right, open these up here. Okay. Oh my gosh, all of a sudden. So then my gloves. What's wrong? So, and then I can stick this here. Okay, and then I can go ahead and discard this out of the way. Alrighty. I'm gonna put that off to the side. This is all sterile field. I'm gonna get my lube ready here. So lube on the lid. I don't need that piece. Okay, just keep that in here. Okay, I'm gonna place one more cover kind of over you to just really keep that sterile field clean. And now that I've placed this here, I'm going to keep my left hand just positioned here, not touching anything else. Okay. All right, it's going to be a little bit cold. I have some iodine swabs I'm going to use. So iodine swab number 1, swab number 2, and iodine swab number 3. And then Susie, now I'm going to go ahead and insert that catheter. So it's just going to be a little bit of pressure here. I'm going to pull this up. And I'm going to go ahead and insert this about 2 to 3 inches in. All right, we are getting some urine output here, so that's good. We're still going. And it's slowing down a little bit, so I'm just going to go up just a touch more. Just make sure there isn't anything else up there. Perfect. Now I'm going to start pulling out real slow here. Make sure there aren't any other pockets of urine that will be missed. You doing okay?
I'm doing just fine. Thank you for asking.
Okay. Pulling this out. Looks like we got a lot out here. That should hopefully get some relief for you. Okay, I'm pulling this all the way out, and I can discard that. Now I'm gonna put this off to the side to measure that in a bit. All right, Susie, I'm gonna get this out of the way, and then I have one more washcloth here. I'm just gonna kind of get that extra lube off here. Clean you up just a touch. Okay, and then I'm gonna get all of this out of your way. This off to the side, get you repositioned and situated. Okay, I'm gonna take these off, and then I'm just gonna note the volume of the urine output, and then note if there's any abnormal findings like odor, blood, discoloration, anything like that. And then again, just make sure I measure that output accurately. And then Susie, I'm gonna go ahead and put you back down, and we'll see you in a bit.